Hello, I am Deb Joachim, and I am a brain injury survivor. Thank you for hearing me out today. I have lived a life that I would not wish on anyone. Brain injury is one of the worst unintentional injuries there is. Brain injuries can mimic many illnesses. Bipolar disorder is just one of these disorders. In our textbook, Community and Public Health by Dr. Robert Ferris, in Chapter 9.3, Types of Mental Disorders, he talks about how severe symptoms can make it hard to carry out day-to-day tasks. When diagnosed with a mental disorder, synthetic drugs are prescribed to help the person live without the symptoms related to the disease. Synthetic drugs can help in some cases for some things, but they do not encourage healing. They may mask the problem and cause the target area to lay dormant. As time passes, the lack of use in any area means trouble. If we do not use our brains, they give us chronic diseases like dementia and Alzheimer's. We need a creative drug to give us a creative way to find peace inside a terrible injury. As the growing use of marijuana has been studied for over 20 years, the stats are many and the number of states that are legalizing marijuana is increasing. I am here in support of medical marijuana. Without marijuana helping with the healing and recovering I have been through, I am not sure I'd be here today telling my story. Over my lifetime, I had suffered over 3 life-changing brain injuries. The first injury was in the 60s, and the last was in 1995 when I fell on ice and landed on my head. This started me losing much of the way I could still think. Over the next 10 years, my body was dying on the inside, and I was still living on the outside. I could go to doctors, and they'd assure me I had nothing wrong with me. I had a brain MRI in 1998 that showed no signs of cancer. Over time, I became unable to think straight or function. My body was crippled from several accidents that landed me with 2 back surgeries, one in 1999 and one in 2001, leaving me to move even less than before. I had no good minutes left in life. I was faced with living life from a wheelchair or being confined to a house most of the time. Nobody could help me. Few wanted to live their life in my world. I was alone. I had to isolate myself from others due to the different lifestyles we lived. My family could not understand why I no longer did the things I used to do. I looked the same on the outside, but I was unable to eat much, breathe without trouble, and move as I once did. I felt like my life was over, even when I tried to convince people that I was the same person I'd always been. My memory was fine, my body function was not. I was now living the life of an invalid with little hope left for life. I started smoking marijuana in the late 1990s because pain medicine was not something I had a regular source for. All my doctors would tell me if I needed more pain medicine, I'd have to have pain management therapy. As far as I can tell, I was already managing my pain. I knew where it came from, how much it hurt, and that I was going to live like this the rest of my life. I really did not know what else they could tell me. I managed to wake up each day knowing I'd have to go through the same thing once again. Chronic 24/7 pain, trouble breathing, and a life not worth living. Marijuana was not just there for me, it changed the way I felt about my life. It let me see through what was really going on inside. It gave me a strength that I had not felt in many years. It breathed new hope into my body. When I had trouble breathing, I sometimes found myself in a panic. Medical marijuana let the panic slowly release itself, and I could take control of the breathing exercise with calmness and movements that helped put air back into my body. In a short time, I could keep the breathing exercise in a rhythm. Without the rhythm, I was lost and not able to control any of the problems I felt inside. I would fight my way through many events where I felt good enough to leave the house, only to find I'd lose my rhythm. I would go off by myself so I could make the same movements I did at home without any luck. I could not find the rhythm needed to control my problems. If I had been in a state that allowed me to use medical marijuana, I'd have been able to regain control of my needs and enjoy the event I was at. Without marijuana, I only wondered why I thought this time would be different from the others. Why was I here when I knew I'd not be able to enjoy the outing? Anything over 3 hours was more than I could handle without a workout that got my body under control. I knew I would be in a struggle by the time I returned home. Over time, this led me to leave the house even less than before. I would have been able to keep myself running forward instead of stopping the healing that was taking place inside. Yes, I realized along the way that I was moving into the good when I was healing, and stopping the movements that felt good only brought back the bad feelings. Blockages that were allowing the air and food not to go down would start as soon as I stopped the rhythm. I had about 3 hours before I was completely down again. What became a way of life over time began to let me understand where I was heading. I realized I was changing the way all the pain that had taken over my life showed up inside. I did not use pain pills or over-the-counter medicines. I became pain-free within 3 years after I started my workout with rhythm. I could only find the rhythm after smoking marijuana. It let me relax and regroup my thoughts to find what I needed to keep myself moving forward. I was beginning to understand that I could make a difference where doctors could not. They did not know what was wrong, and I started finding little changes that were taking place inside. Marijuana was all I needed, and synthetic drugs were not. I had resisted taking dangerous pain medicines because all my life I heard people like Betty Ford talk about getting hooked on medicines that doctors prescribed. I was not wanting to have to deal with another problem in my life. If you look at the stats from 2002 to 2006 on people with brain injuries annually per the CDC, 1.7 million people are affected by brain trauma. The death rate for these injuries is 52,000 annually. A third of deaths from injuries are because of brain injuries per the CDC. If they could be even a little hope that some of the people that survived these accidents could find a way to get better, why would the government not look at a positive effect of marijuana? For the people that live, many will be put on synthetic drugs that could leave them with many side effects. Not always able to communicate the problems may hurt the user more than help. When synthetic drugs are used, changes that happen over time may leave the user with less ability to do what they have been used to, blocking the healing from taking place by means of masking complaints instead of finding complaints and working through them. Marijuana highlights any pain or injury so that the injured knows what and where the problem is. Without knowing what is wrong, fixing what is wrong cannot happen. If marijuana had been legal in Texas, I would have been able to receive other forms of the drugs besides smoking it. In many states where it is legal, they have oils, food, and drink products. These could be considered a much safer way to receive the benefit besides smoking. Dr. Wateroo and Dr. David both gave their view in this topic in Dr. Wateroo's paper, Two Views. The history says cannabis is one of the 50 fundamental herbs used in traditional Chinese medicine. Dr. David and Dr. Wateroo said that without the FDA approval on how marijuana is used, they believe it should still be illegal. They also stated that many countries use this herb to help with internal problems such as gastrointestinal disorder and pain, two of my biggest problems. Some of the other problems I had were sleeping, headache, and movements. Marijuana contained THC, which has been used to help with these problems as well, per Dr. Wateroo. I know that new sources are being made and properties are changed. This could cause the herb to lose much of the normal good it has helped with for centuries. People could grow their own medicine, making sure labs do not abuse or change the mixture, making it like the drugs with warnings we need to consider before taking. Looking at McDonald and Somali's work on 10 years and growing medical marijuana in Rhode Island, where are we now, talks about having legalized compassion centers and primary caregivers who grow medical marijuana to assist with patients' needs that outweigh the health risk. The cost would stay at a price people could afford if legal. In 2014, 21 states and the District of Columbia have legalized the use of medical marijuana, and many more states are considering its use, as per Anderson, Reese, and Seba, who wrote Medical Marijuana Laws and Suicide by Gender and Age. They said using a lower dose can help with relief as an antidepressant. People that live with brain injuries have limits on their abilities. With legalization, the price would go down, and the type of marijuana would be better controlled. Some uniformity in the degree of strength would help those that are not as severely injured as others. When you think about life with brain damage and what it takes to get through a day, can you tell me that marijuana will really hurt? I started school in 2014 and wanted to do the right thing, so I quit smoking to help take on my new adventure. I wanted for the first time to give school everything I had to do good. I had not been able to get through school in my early years, unable to keep up with the pace. I was starting college in my late 50s with a different mind. Over the next year, I found I was stressed every minute of every day, and life was a struggle, but I was making grades like I had never made before. My brain was working again. I thought this was where I needed to be. I was offered a little smoke and I accepted it. I realized I had not had any relaxation since school started. I was running on fumes. After smoking, I found I was able for the first time in a year to see that I had not been in rhythm. I was doing better mentally, but still fighting my body along the way. Still not able to breathe, eat, or sleep well. I was close to burnout. I needed to get back the rhythm I had lost from lack of marijuana. In the next few months, I noticed school was going much better and my body was moving forward again. I spent a year trying to find my way, only to wear myself out. I had come so far in my healing, but without marijuana, I was not going to keep finding the right path. I started with much smaller amounts than I used before, letting me know I was doing much better and getting well. I could feel the difference in how I was holding up daily. I owe my life as it is today to the many roads that marijuana led me on. I found the road back to good health and college that I never thought would be a part of my life. I am 100% pain-free, eating any and everything I want, and sleeping during the night, waking up better and refreshed in the morning. My breathing is now normal. Seeing where my life started by viewing the video on TED Talks by Dr. Chandran Shettiharthan, Can the Damaged Brain Repair Itself? I would be like the man in the wheelchair, with the difference being I overcame those problems to where I am today, living a productive, active, and pain-free life full of family that now understands better what I have been through. I can honestly say marijuana helped me to become who I am. My grade point average is 3.43, which is very exciting for me. I hope that through all the negative, the good can be seen and legalization can be worked out. It has taken over 10 years to work my way to this stage of my life, and I would not change a thing. I have learned many lessons needed to make life great after brain injuries. Thank you for your time, and please consider what I have been through when making your decision.